Medically, when you hear titis, such as in tonsillitis, conjunctivitis, and dermatitis, you must know that it means inflammation. Now, dermatitis, simply put, is the inflammation of the skin. To help overcome such inflammations, Konga Health, the health vertical of Konga, has moved to possibly help us put an end to some of these skin conditions by partnering CeraVe, the world's leading skincare brand, under the L'Oreal umbrella. Thumbs up, Konga Health. Did you just ask why is this important to me? Well, it is important because skincare awareness took the center stage worldwide on the 8th of this month to, among other things, raise awareness and action towards achieving skin health for all. In a world where cancer and other diseases are rife, it is important, you will agree with me, to be careful about not just what we eat, but also what we use on our bodies. By using CeraVe's dermatologically tested skin range, you would have done your part to ward off skin issues. And that is how I open today's show. Welcome to Talking Health with Bumi. Last time, Dr. Ladi Alakija, the medical director at JLT Specialist Clinic and Skin Center here in Lagos, shed light into some do's and don'ts to maintaining a good skin. Follow me to his clinic to learn more. Okay, so you did, I'm glad that you used the example of psoriasis and eczema. You've used both. So, there are a lot of ladies particularly, and many of us cover up because with makeup. So many ladies and children have eczema. Can you give us snippets of how this can be managed?
Well, if you're talking of psoriasis, psoriasis is not eczema. Eczema in dermatology terminology simply means inflammation of the skin. That's what it means. And it's another word for dermatitis. Dermatitis, eczema, they're the same.
I see.
So there are certain things that would cause dermatitis. There are certain things that would cause eczema. In psoriasis, which is a particular entity, the skin could have inflammation and some other things which are peculiar to psoriasis. So, how do you manage it? In the practice of dermatology, it depends on what the diagnosis is. I talked about psoriasis. We manage psoriasis with steroids, oral steroids, and also steroids cream. Some dermatologists, including myself, psoriasis, you manage with not just the cream, steroid cream, you also mix the cream with tar, T-A-R, tar. Because it's been known that those things, they tend to quieten psoriasis.
I see.
And when you saw this lady that I just saw before you came, she got up and she hugged me and I said, oh, thank God my wife is not around. And she was very happy. And the only thing is, she said, oh, doc, I don't like taking prednisolone, which is a steroid. And I said, well, I'm only giving you very small dose. You need to be worried. Unfortunately, she hasn't got peptic ulcer. She hasn't got ulcer, which could have been a contraindication to the use of the steroid, because steroid could irritate the stomach. But fortunately, she hasn't got so. And she's not reacting to the steroid we're giving to her. So she's done very well. So it's not many skin diseases that are contagious. There are some that are not. There are some that are contagious. There are some that are contagious. Once they're contagious, obviously you warn the patient. You alert the patient that, listen, be careful. If somebody's got, say, chickenpox.
Yeah.
Chickenpox is contagious.
That's right.
With all the rash on the body, if another person touches or the fluid from the rash touches
somebody else,
it could get it. And I said it could, not he will or she will. No.
Oh.
Again, it all depends on your immunity. I made mention the other time, I said, during the time of the coronavirus, it's not everybody that came across coronavirus that got infected. Again, God is so good. Your immunity may be sufficient enough to ward off
the
the infection. So it's not everybody that is exposed to a contagious disease that will succumb to it. No.
Okay. So, doctor, I'm concerned. I've seen a lot of people who look older than their ages, and you see their skin's wrinkled. Why is that?
We all have different DNAs in our
Okay.
body.
I see.
My hair is all gone white.
True.
Some other people who are even older than I am, their hairs, they could still be blackish.
True.
My own genetic or my DNA, my body, the way God has created me is different from the way God has created person number B or person number 2 or person number C.
That's right.
We all belong to different genetic factors. So the fact that a woman A has got wrinkle and a woman B hasn't got wrinkle, they could be the same age. Everybody ages every day. The skin ages every day. But the rate of aging obviously is different in different people.
That's right.
That's it. Although, if a person has not been having some good diet, which also helps the skin.
Okay.
If you consume some very, very good multivitamins, vitamin B for instance, vitamin C for instance, they also help the skin. So if you have somebody who has not been consuming very good diet, obviously the skin becomes aged
Wow.
faster than the other person.
Now, doctor, some people actually consult cosmetologists to give their skin a boost, and by so doing, they use anti-aging products. What have you got to say to this?
Well, I can tell you straight away, I'll tell you for free. Most dermatologists, and I know that because my colleagues and myself, we talk a lot and we dialogue a lot. It's one process that we are not too much averse to agree to. Most people who go to either dermatologist or even cosmetologist telling them that, oh, they want their skin to look good, 80 to 90% of the time, there's nothing wrong with the skin.
Oh,
There's nothing wrong with the skin. They probably saw a colleague with some very good skin and they just want to look like the colleague. And they go to the doctor. I mean, we saw one patient 2-3 days ago. She's a lady, I'm sorry to say, and usually they're women. Most of the time they're women.
Yes.
You hardly find men
doing
coming
that.
to say, yeah,
Yes.
most of the time they're women. She came and said, oh, that her skin on her face doesn't look right. My doctor saw her, and my doctor called me to come and see her as a consultant. And I looked at her, there was nothing really wrong with her skin. And at times, yes, there's something we call placebo in the practice of medicine, placebo. Placebo simply means you're given medication. Patient doesn't really need it, but you're giving the medication just for patient's psychology. You understand? But it's important for a doctor to be truthful. So I told the patient, I said, listen, it's my field in dermatology. I'm a dermatologist. I have looked at your skin on the face. There's nothing wrong with it. And I made sure I explained to the lady, I said, listen, the body, the skin, there are grades of normal skin. You don't expect your hand to be the same as mine. The two of us can be normal. Mine may have more veins than yours.
Yeah.
Having more veins is not abnormal. It's a normal. So, but because she actually wanted something, we prescribed some placebo cream for her. But we told her, we said, listen, you can use this, but please, madam, don't think by the time you get home and you apply the cream, your skin,
magic.
no. And she was quite happy. But most of the time, dermatologists don't agree to people just come to say, oh, I want my skin to. And unfortunately, or maybe fortunately, the cosmetologists, they make so much money because some of these women, they go to them and they charge them hundreds of thousands of naira.
Sure.
And they put all kinds of things on their faces. They put cucumber and things like that. And they're quite happy. And after the cosmetologist is finished his or her job, whether it's going to help her or not, they believe in their psyche that, I've gone through good treatment.
Thank you so much for staying tuned. Let's go on a quick break and we'll be right back.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only, I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Welcome back and thanks for staying tuned. We're still with Dr. Ladi Alakija, the medical director at JLT Specialist Clinic and Skincare Center in Lagos. I want you to explain to us, what's the place of sleep in maintaining good skin?
Sleep is related to not just good skin alone. People with blood pressure problems, they need to relax, they need to be calm, they need to sleep well. Stress is a very, very big factor in pushing out diseases. We keep talking of psoriasis. Psoriasis, for instance, stress is one of the factors that brings out psoriasis that is been well under control. Pimples, acne, pimples. Stress is also one of the factors that pushes out pimples. Although a woman will come to a dermatologist and say, oh, my pimples will come out when I'm having my periods. Periods is stressful for a woman.
It is.
pain in the tummy, pain lower down the tummy, so the stress is, so sleep is very important. If a woman is not sleeping well or a patient is not sleeping well, they tend to get more skin problems.
With everything, we have a lot of associated myths. You've been in this practice for over 50 years. What are some myths that you have heard over the years that are associated with skin that you would like, our viewers to be aware of?
I saw a patient yesterday
Okay.
in my consulting room here,
Okay.
and he's got a skin condition called pityriasis rosea.
Oh.
And I'll
What
tell
is
you.
that?
Okay. Pityriasis rosea, it's a condition where you get usually you get the first one patch, herald patch,
Okay.
followed by rash all over the body,
Oh.
itchy,
Oh.
reddish, which is why it's called rosea.
Okay.
Pityriasis simply means scales. So this guy has got scaly rash, itchy, and reddish. Immediately I saw it, as an experienced dermatologist, I knew the diagnosis. Now, this clinic, we have a policy. We will always explain to every patient we see here. It's like a lecture. We would tell the patient exactly what's wrong with the patient. In fact, what I do is I normally give every patient I see my complimentary card. And behind my complimentary card, I'll put the diagnosis.
Oh.
I do that all the time.
Okay.
And the reason why I do that is I tell the patient that, listen, when you get home in the evening, you have a smartphone. Virtually everybody's got a smartphone in
right.
Nigeria. Go to Google and put the diagnosis on Google and enter so that you can learn about it. But I'm going to tell you what the problem is now, and then you can ask me all the questions. I do that for every patient that comes to this clinic. So I told him, I said, listen, what you've got is pityriasis rosea. It's a self-limiting rash. Within, say, maximum 2 months, 3 months, whether you treat it or you don't treat it, it will disappear. But we have creams to give to you to hasten the resolution, which was what we did. And the man told me, said, no, doctor, are you not going to give me injection? And I said, no, you don't need injection. He said he believes he needs injection because his stepmother is the cause of his problem.
An injection is going to kill that.
And he believes that without giving him injection, it will not help him because he believes the stepmother is the cause of the problem. And I really had to talk to him. And I said, listen, that I can even bet with you, in 2 months, call me. If you still have the problem, come back to this clinic. You will not be charged anything. But I can assure you, within 2 months, it will all have gone. In Nigeria, everything that happens to anybody, there is somebody else who is responsible for it. My friend, name withheld, we see in church every Sunday, grabbed me after church last Sunday, said, Doc, please, can you come? Let's go to the gents. I'd like to show you something. I said, what do you want to show me? He said he wants to show me a rash on his body. Okay, let's go. So we went to the gents, and he pulled up his t-shirt, and I saw a rash there.
Okay.
Classical shingles, herpes zoster.
Ooh.
And I said, my friend, did you have chicken pox when you were small? Yes, of course I had chicken pox. I said, yes, you had chicken pox. It's as a result of the chicken pox you had when you were a little boy. After the chicken pox subsided, you will have the virus lay dormant in the dorsal ganglia at the back.
Oh.
And when you grow up, maybe after about 20, 30 years, when your immunity drops, either maybe got some under the weather, as they say, that will now spring up. I said, no, he was sure that it's called it devilish attack, yes, devilish attack. And I said, okay, that devilish attack, can I give you some cream that the devil does not like?
Interesting.
And on Monday he came here and I got a case file for him, and I got it. He called me just this morning and said, that rash is almost gone.
Okay.
I said, hey, because my own devil thing will not allow the rash to... So, in Nigeria, everything that happens to anybody, there must be somebody who does not like the person.
Okay.
It's always like that, which is the reason why I tell my doctor, you must talk to patients. This is not a hospital where, this is a specialist clinic. They're coming here because they want to see the specialist who they believe knows his onions. And we must talk. So we talk to our patients. We lecture patients. Like I said, every patient that has been to this clinic has got my complimentary card with the name of the diagnosis written at the back. So that when he gets home, he can Google it. And he will learn more about it. But then before he Googles it, I would have told him things to do. Oh yes, that we find that all the time.
Thank you so very much, Doctor.
Yes, thank you very much.
A pleasure speaking with you. We're enlightened, and I'm sure my viewers have a lot to take home today, particularly when it comes the myths, knowing that not everything that happens to your skin is an arrow. That's quite funny. You just see a specialist to address the issue for you.
For many people in our climb who tend to check with the spiritual first before the professional, well, Dr. Alakija has given you his 2 kobo. Check with your doctor first. Not every skin ailment or disease, for that matter, is an arrow. On this note, I call it a day on today's edition of Talking Health with Bumi. Please do keep a date with me for another intriguing edition, I promise you, next week. You can contact us on the numbers on your screen or simply go to Konga TV on YouTube. Don't forget when you view to subscribe, like, and share. Follow us also on all our social media handles as displayed, or simply search us out on any search engine. Until next week, think health matters. Think Talking Health with Bumi. Bye.